Good morning, good afternoon, good evening, uh, good, very late night, wherever you are in the world. Thank you so much for joining episode number 4 of Unboxing AI, CARPL's weekly webinar series. Uh, you know, we needed to change the time a little bit today because of some engagements that I was in. But yeah, coming in here from Dallas, I have today uh, our dear friend and collaborator, Ron Nag. Ron is the founder and CEO of Medcognetics, one of the most advanced um, mammography, both 2D and 3D AI companies out there. Ron has a very different philosophy on running Medcognetics, which is very different from routine startups. So I'm sure we'll go deeper. But for all of you who don't know what CARPL is, we are an enterprise imaging AI platform. Uh, Essentially, we serve as a connector between the world of AI and the world of radiologists. And this is just an attempt at showcasing some of our partnerships, some of our friendships, and essentially bringing about impact in a teeny weeny way. And uh, to begin with, quick intro of Ron's. Yeah, I think I have known Ron since maybe 2018, uh, and I think Medcognetics was not even called Medcognetics back then. I think it was called Pegasus Health, if I'm not
That's
wrong.
that's right.
and and I found it very intriguing as to why such a senior executive um, you know, uh, Ron has had a pretty amazing career at, I think, primarily at Texas Instruments, building out like real hardware, hardcore technology stuff. So, and now, for the last, I think, 5, 6 years now, Ron has devoted his life to solving breast cancer screening to begin with. And yeah, Medcognetics is one of our closest collaborators. We're live at various sites across the world. And, yeah, so thank you for joining today, Ron. Thank you for taking out time and would love to take this forward.
My pleasure. It's always good to see, and now an old friend in you, Vidart, and giving me the opportunity to share a very fun and wonderful conversation because, every time I talk about Carpal, I smile because of all the great people and all the great journeys we've had together and we continue to have. So thank you for having me on.
No, thank you, Ron. So, Ron, why don't we? So this is for everybody who's also joined, right? We try to make this very interactive, very informal. Feel free to write in the chat box, in the Q&A box, wherever if anybody has any thoughts. We will try to address those questions, during the call, or alternately, we have the Unboxing AI LinkedIn group where all the questions get posted, and then we can kind of take the conversation there. Um, so in that spirit, Ron, why embark on this crazy journey at this point of time in your career of solving, one of the most difficult things there is to solve, um, breast cancer using AI? Like, what's the rationale? Why?
Well, I grew up in somewhat of a traditional South Asian Indian household. So there were only four career choices: doctor, engineer, engineer, or doctor. You choose. So I became the engineer. My brother became the doctor. My whole family is life sciences. I was the strange one that did earth sciences and physics. Chemistry was boggling to me. But but with that in mind, the biggest thing as an engineer is you're trained as solving a problem. And when I was working at a chip level, you were really working at a very uh, nano or micro level. And sometimes it was harder to see the bigger picture. And, how did that have an impact? And I think because of my family background also being a child of two teachers and two professors, one of the last things my father told me was he was a heart researcher himself, and his research never saw the light of day to help a patient. He said, one of the things you should be able to do as a problem solver is be able to use this tool of solving problems, go back to the universities or the research world to see if you can pull something out to help someone. And that started my journey of leaving the semiconductor industry. I went into healthcare. I was an executive at DaVita Kidney Care. I also worked in neurology startups. And it really became about superior patient outcomes. And, I really have centered the company around that. Even as we found the capability and technology of detecting and classifying cancer, we never just jumped in as a group of engineers trying to run to a doctor. We stopped, we built a quality system first, and we hired really, board certified breast and other radiologists to be our internal customer, and always about customer first. And that really is steeped in our discipline. You won't hear me talking a lot about all these kind of technology bits, because to a physician, that's not what matters. AI is another tool, and how do they use that tool effectively? No different, either you have an MD. This is no different than a stethoscope or a blood pressure cuff. It's just being used differently with ones and zeros instead of listening with your ear, So
Yeah.
that's kind of the way my journey really started, and focusing on the largest engineering problem that I think of is healthcare anywhere around the world. It's massive.
So can you, Ron, on that note, right? I try to do this funny thing in every in every session where I ask the panelist, can you explain what it is that Medcognetics does, as if you were telling a 5-year-old, right? How would you do that?
Oh, that's really easy. Me and my
Uh,
team help with the using computers find bad things in people's bodies so it doesn't get worse.
Very interesting. Would you classify a McDonald's burger as a bad thing?
Well, it depends. You're in America, so probably not. But
No,
something that makes you,
that's a
bad
very
things that make you sick. Well, I guess a McDonald's burger could make you sick too, I suppose.
no, that is actually a very insightful way. And what would be the longer version, like for viewers out there that don't know what Medcognetics does? Um,
So
could you share
the
some of that,
longer
please?
version, if you're a little bit above 5 years old, which I kind of am by a zillion years now, is that we have looked at image processing in a way to use AI along an image pipe to determine if there is cancer in a body mass, and specifically the first area of interest that we're working on, there are other areas of interest that we're also percolating, is in the breast mass. And we've been able to do this with peer-reviewed research coming out of the University of Texas system. So our capabilities came out of the University of Texas at Dallas, as well as either where you're sitting today, University of Texas Southwestern Medical Center. Both of them are partners. One was the technical partner, one was the clinical partner. And I had the good fortune of meeting as an entrepreneur in residence for the UT system, a imaging engineer who was getting their PhD, who then became my CTO, and his PhD is the basis of Medcognetics. And it's given us a wonderful way to work with large research institutions because we know how they work, we know what they need. And, for us in the UT ecosystem, we can go to any one of those campuses because we have the same mandate to operate in that way. So it's been very good for everybody
So
involved.
talk a little bit, Ron, about the startup journey itself, right? So prior to yourself, the first 3 sessions we had clinicians
Mhm.
on the webinar, right? So so I've actually not been able to go deep into the business side of things, right?
Mhm.
So share a little bit. on that, right? Like, uh, what were you thinking, right, when you started Medcognetics, and what's the journey been like? Like, you're a little different from the hyper funded startups out there. What's the philosophy there? I'm sure you would have investors chasing you left, right, and center. But so just your philosophy around building a business. Uh,
Right.
you know, I'd love
Yeah.
to learn more about that.
Sure. No, that's a great one. Um, we know we we fund ourselves in a way that makes sure that anybody that funds into us gets a maximized return as it happens. And we, try to cut the cloth according to the size of our suit, not making it too big, not making it too tight. Um, and the journey of this was really once you set around one goal or mantra of, you want to center it around the patient. Everything can build around that. Technologists start around centering around the technology. We didn't do that. We really worked that way out. We now have many multiple papers with UT Southwestern and more coming from different other institutions. And it's because we want to make the impact to people in society, and then we as technologists to see what tools we can use to do that. And this is where I have to make my first plug for CARPL and Vidur is when I started this journey, what you actually said when we met on that RSNA floor, he said, and we were in the AI pavilion, and you said, remember the quote directly, Ron, look around you. There's 45 to 60 startups here all saying that they can do this. But think about, how they train their data and, can this really make an impact everywhere? There's something that worked in country A and is really good in country A, but doesn't work in country B at all. Or country B doesn't work in country A. And this just adds up and compounds. That's when I actually, took Vidur's advice to heart and we stopped and said, what are we trying to do? Because if you think of the United States, it is truly, as we proverbially call it, a melting pot. We are of all nations of the world. And how do you have to service that? And the US government knows that, especially in AI services now, be it in health and human services or making better equality for people to get mortgages in the United States. And we had to stop. And then I put on my Texas heritage, which is, Texas knows energy and oil. And if data is the new oil in this economy, you have to do some things you have to do very, very well. Just like with oil, you have to know where it is, how to pull it out of the ground. When you pull it out of the ground, what are you looking at? Is that home heating oil, sweet crude for an automobile? What is it? How do you then refine it and distill it? And then how do you distribute it? We got really good at building that ecosystem around the world. And I'm happy to say, now the US Patent Office has given us essential patents on what unbiased AI looks like. So it's resilient around the world. And that journey only started because Vidur stopped. I was going into my pitch about where the company goes. He goes, whoa, 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 just stop and look around you. And that's how that journey started. So the credit goes to you to a lot.
I wish I was as insightful now as I was back then. But no, thank you, Ron. That means a lot, and you know, we continue learning from you as well. And it's I think that's the ecosystem effect that we are also trying to have, right? Is is there something you can say today that one of the people listening in can like changes their trajectory, their life, their professional life, their personal life, what have you. So thank you for sharing that. I think on that point, uh, I have to put a like a shameless plug for couple. so uh, so can you share a little bit about what is the role that we play in Medcognetics' journey, if I may? Um, you know, uh, Maybe today, maybe earlier. How do you see it pan out over the future? Uh, Working with a platform such as us, and would love your thoughts on that.
Yeah, sure. it comes up to a couple things. First of all, is the collaboration is very high between both teams. We work in real time to solve problems for our customers and things like that together. But the thing that you started off this conversation, Vidur, as you introduced CARPL, of that bridge between the AI world and the clinical world, that's been, I think, the most beneficial part of the journey, because the technology pieces we have, you're also very lucky to have many bright and gifted and enthusiastic people like I do on both our teams, and they work wonderfully together. But it's really bridging and finding those clinicians and then they say, I really like this algorithm. I really like the fact that you've trained on my population's data set and it's good. How could I administer you? And when I say, well, we're working with CARPL, it's like, oh, we already got that. So we can plug you in, try it out, and we can recursively do things. And so that facilitation is massive. I think that the only way these AI ecosystems will grow is by collaboration and this kind of facilitation. So moving into the future, I see that going even further, where if we start to see best-in-class services, how do we club them together to provide them to institutions and things like that? And also in different modalities. When you get a mammogram done, there are many follow-up steps if they find something. How can we help them along that total patient journey? I think there's open questions there, not unanswered, but they're open and they're yet for our interpretation to figure out how to go make happen.
Well, that's very cool, Ron. And of course, like I said, we love working with Medcognetics, the team, Medcognetics, the product, also. But do you also feel, Ron, that there is an element of are there any cost benefits that we bring to you? One is of course the distribution and all of that, but do you also feel that, like, and I'm going to be very candid about this, right? Does working with CARPL increase your cost base or reduce your cost base from a technical
Um,
standpoint?
in deployment sense, it decreases the cost base because you guys handle that front end. But
Hmm.
in all fairness, we still have to go manage our own regulatory pieces. So, but aside from that, there's so many times that cost basis has come down in the deployment because, you know, I'll say, well, we're working with CARPL, like, oh, we have an IRB with them, we have an agreement with them.
Hmm.
And it really cuts the cost there for sure. That's absolutely the case on the deployment side, and it facilitates discussions quicker for sure. So that really works out great. And then the other thing is the cost savings or the operational savings we get is, let's say one of our clinical partners has a request. Hey, can we try another feature that you just talked about? Sure, we just turn it on and it cascades right through the system.
Yeah.
It's not like set it up, get it approved, put it in, and literally they can ask for something on a call, and within the 24 to 36 hours, depending on their IT, not ours or the CARPL platform, they have it.
Yeah. No, that's pretty cool, because the reason I asked that question, Ron, is that sometimes there's this apprehension that working with platforms, and I pride ourselves in being a little bit more flexible, uh, you know, towards in the AI company's favor. So we try to avoid putting overhead on your team to adhere to our standards, and instead, we have Rohit, Risham, Abhishek, these guys who have kind of created their own, I don't even know, adapters to plug into any AI, now that we've done
Yeah,
this so many times. So it's very heartening to hear that
yeah,
there is no increased development cost
yeah,
in working with us, because
yeah.
this was not in the script.
Yeah,
So
no, here's one that I can give you as a direct quote that goes to your point. So Tim Kogan, who is our CTO, and Tim, he says, we work with,
he's listening in as well. I saw him in the
oh,
list.
okay. All right. Yeah.
Yeah.
Excellent. So yeah, great, Tim. That means you get another cocktail at the end of the day. Um, so uh, the thing that he says is that with CARPL, we just give them our API and setup, and it just gets done. And from a technologist and engineer to have that confidence is huge. Instead
Hmm.
of, that, and I'm not trying to be derogatory, but that hand holding that has to happen with a partner, that is next to minimal to none working with CARPL, because
Wow.
there's a rapport. Tim knows what to send over. That, I mean, literally things can be solved over WhatsApp. You don't have to get on a huge call and do a ton of things, and that goes to the credit of being flexible and understanding that every Lego block is not the exact same shape, or Tetris block,
Yeah.
however you want to look at
That-
the puzzle.
Yeah. Well, that's a good way of putting it. We do have a few questions coming in, Ron. So maybe just power through them towards the end of the session. So there is one which is uh, I'll just go in order. The first
Yeah.
one doesn't want to disclose their name. It says, we've seen various mammo solutions, each giving back a different score based on their own conventions and not giving standardized scores like BI-RADs. What do you think is the reason, and how can AI outputs be standardized to this extent that you get a BI-RAD score that is universally applicable as opposed to different kind of outputs that different companies give?
Well, actually, that's a great question, and this one gets actually tussled around within our own office, between our technologists and our own clinical development officer, Dr. Paula Gupta, who trained at UT Southwestern as well. And uh, because the answer to the question is, BI-RADS is not a cut and dry system, and radiologists or breast imagers want to have that call. They want the inferences from AI to make that call. But, if they start off with a BI-RAD 0 or 1, and if it's not one of those, it gets bumped up to another level to be determined. And um, and because the radiologists look at AI as a physician's decision support tool, I know that's a long
Mhm.
way of putting it. They want We're getting the feedback that the physicians want, or the radiologists want, our best inference. And the way we standardize is we show them our baseline of how we model, or how we make
Mm.
those capabilities. The same way that we have to disclose to the FDA our statistical models to say how we're providing that influence or inference uh, to the radiologist. So the short answer is, everybody wants a BI-RAD score to punch out of an AI system. However, if you ask the end users, the radiologists, they're not necessarily
Mm.
asking for that.
So they'd rather look at the inference and create their own BI-RAD score, which
Right.
is what is happening today. Very interesting.
Right.
The
Yeah.
next is, from Aditya. Aditya looks at regulatory at CARPL. So he is asking what measures are in place to continuously monitor and improve the unbiased performance of Medcognitics AI. So yeah, what do you do to monitor and improve the performance of your model?
So that's also a great question, Aditya, and good to hear from you. Uh, what the big thing is one thing I mentioned early on is we've created a quality management system and have a quality manager that we have to have our own policies and procedures to recursively look at our system and to constantly continually to train. Um, Although I'm very proud that we represent quite a bit of the world, there are places that just the fundamental lack of healthcare getting to some of these population bases all over the world, and I'm going to make a generic term, indigenous peoples around various geographies. There's indigenous people in Latin America, in Australia, even in Southeast Asia, even Asia, uh, Greater Asia, that they don't get represented. So we continue to look for data sets. We've kept to that heritage of keep drilling for oil to look for some of these specific types of oil or data to do so. So we have that as part of our policy to continually to update. Now, once you have an FDA, you don't change your algorithm on the fly, but once you have enough done, you can, resubmit or add a, letter to file.
Got it. So essentially, you're continuously looking for new data, to improve the performance of the model, but you can't actually do it on the fly. You have to put some like temporal checkpoints such that,
Yes,
then you inform the FDA, maybe do a new trial and,
right.
upgrade the model, so to say.
Yeah,
Nice.
you have to have a policy, procedure, and a process.
Yeah. There is a comment on the previous question that says that ultrasound AI are able to give BI-RADs from images. I think BS has asked this question. Do you like to respond, Ron?
Yeah, we've seen that as well. But again, it comes back to, you know, what are they basing that BI-RAD score on? What is the set of rules that ultrasound AI is used? That's
Yeah.
the one thing that we come across all the time. We see this in ultrasound, in mammo, and in CT. Everybody has it. It may say 1 through 5 or 0 through 0 through 5, but really that scoring is institution to institution has changed and changes by the modality. So we by putting a BI-RAD out there, you're actually asking yourself to have more scrutiny.
Scrutiny. Yeah.
And the scrutiny is not regulatory. The scrutiny will be your end user. It'll be the
Yeah.
physicians.
Clinical. Yep.
It'll
No,
be clinical.
I think the short answer would be, Ron, maybe that it's not that you can't do it,
You
but
can
the
do it.
insight is in actually not doing it and letting the radiologist decide what BI-RAD score is. So as we
Right.
are hitting time, Ron, there's one last question, and then after that, I have one question for you. So this is from Abhishek. Abhishek handles AI tech at CARPL. So how do you manage deployments when hospital infra keeps changing, some being on the cloud and others being on-prem? Do you prefer being fully cloud or flexible with the hospital's needs? If you feel it's a long answer, Ron, we could answer this offline as
Um,
well.
Here's the punchline. You need to be fully flexible. You have to understand that these institutions aren't going to change for you. You have to work with them. The same way that CARPL has had success in working with ecosystem partners being flexible, we have to be flexible with our end customers or our end clinical providers. That's the simple
Yeah,
punchline.
I think very difficult to dictate terms to providers.
Correct.
Awesome. So now, we have a couple of minutes left. I usually end with uh, asking like a very simple question around like what kind of advice, this is probably there's a lot of youngsters listening to this, those on the clinical side, those on the non-clinical side. Any guidance that you would have for, folks who are looking at uh, building a career in healthcare AI or in generally in healthcare tech, any words of wisdom for them,
Yeah.
since you've seen
If
both
you're,
sides?
yeah, if you're using the word healthcare anywhere or health, the biggest thing you have to first think around is be patient-centric. It has to be about clinical superior patient outcomes. Anything you're doing, if you're a physician, if you're a technologist, you have to go towards that mission, number one. Number two, if you're going to play an AI, this sounds very low tech, and now I'm going to sound like an Indian parents, do some maths, especially statistics. I think that I'm on the advisory board to bioengineering colleges. And the number one lacking thing that both sides don't understand is statistics, and that statistical model is the basis for AI and what is going to be used in regulatory. So, focus on the patient and maybe get us some statistics under your belt.
I think perfectly summarizes this.
Yes.
So,
Yeah.
it is all about the patients at the end of the day. So, thank you, Ron. Thank you so much for taking the time and for the insights. And thank you to everybody for joining. This will go on YouTube. And next week, we have Dr. John Cruz. He's one of the senior most spine radiologists on the planet, part of RadNet. So we'll be, same time, 11 a.m. Eastern next Friday. We'll catch you there. Thanks again, Ron.
Thank you. Absolute pleasure. Thank you for having me. Thanks,
Thank you.
everybody.
Bye.
Have a wonderful day.